Karen Peabody from Forgewell Solutions, and today we are so happy to have Dr. Marta Zagarda. Did I say that right?
Zarraga.
Zarraga.
Yes.
So I'm sorry. I knew I wouldn't get that right. But thank you so much for being here today. It looks beautiful in your backyard. It doesn't look so beautiful here, but it looks beautiful where you are. So I was wondering, you have a really unique private practice and kind of model for your business. So I was hoping you could tell us a little bit about who you are and what you do.
Thanks so much for this opportunity, Karen, first of all. Call me Marga. A lot of people call me Dr. Marga. I'm actually a family medicine doctor, and I've decided to launch my own membership-driven clinic. Some people know this as direct primary care. But aside from that, I really have a very unique approach to whole body medicine, which I'm able to do because when people are members in my clinic, they have more access to me by text, by email, by phone calls. All of our encounters or visits are comprehensive, nothing rushed. It's really a relationship. It's based on accountability and relationship. And I'm just so happy that I've made this opportunity for that bonding between patient and physician that seems to be more rare. Would you agree, Karen?
I would. I think when we first met and you told me about your practice, you really stressed it was about the relationship, and that's the reason for the membership cost. The monthly membership cost to be a part of this allows you not to have to interface with insurance so much and get bogged down with that paperwork, but really focus on whole body health, not just acute problematic health too. So I wonder, can you speak a little bit to that?
Definitely. So the way that I meet patients for the first time is that I offer them, a free online session for 30 minutes where we have a good conversation on what is called the health roadmap, Karen. So this is divided into your proactive health goals and your reactive health goals. So what do I mean by proactive? When there's no problems and when you are well, that is the time in your life that you should be building a foundation to make your health goals stronger. And when it's reactive, it's more of the emergency room experience, the hospital care experience, or the sick care or sick visit experience where there is already a problem, hypertension, diabetes, there's already a problem that needs to be reversed. So that puts your roadmap into two sections, the proactive and the reactive. And I dive deep a lot. Like 80%, I would say, of the session is really about, first of all, mindset. Like, for example, Karen, don't you agree that a lot of people think that it's an option to have a primary care? Like, they don't really see the point of, they probably don't even know that primary care means prevention. Primary care means advancing your health, healthcare promotion, like solidifying that foundation. They think it's an option but I would just urge everybody to look at the nursing home. And unfortunately, whether it's a lack of resources, a lack of knowledge or awareness, some of our elders suffer from those thought habits that have led them to deprioritize their health. And you see it impact their walking, impact their eating, impact their quality of life and relationships. So if I could turn back time for everybody in that nursing home, I would. And the way that I do that is by working with people proactively through that health roadmap.
Right. Yeah. And I think it was such an interesting point of your practice is not about you see your PCP once a year.
Yes.
You see them 5 times a year. And it's a collaborative, you're always working together, not only on what has happened maybe in trying to correct what has happened, but what has the potential of happening.
Correct. And I want to also say that it's the patient who dictates how much access they want to me. So I have visit packages on my website, Genera MD. Genera is GeneramD.com. and you could see the visit packages there, because then you will be empowered to realize that my model empowers patients to determine how much focus, time, and attention they're going to give their health with a knowledgeable person like myself. Karen, I've been practicing family medicine and healthcare overall for 20 years. I was a biologist in the early part of those 20 years. Then I went on into medicine. But more so, I think what makes me unique is my ability to establish and care for relationships. And the accountability is one thing that a lot of people don't have with their doctor, because in this country, it's only 8 minutes in front of the doctor. That was reported by President Barack Obama himself when he was president, that each American has an average of 8 minutes in front of their primary care doctor. And as you can imagine, what kind of health outcome do you expect if you see your doctor for 8 minutes? How much of your care would really be impacted? So I urge everyone to try to avail of the free session online, and you could call my office at 508-591-0655, 508-591-0655. That you can do a call, you can do a text message, whatever you're comfortable with. And of course, my website is Genera MD.
So can I just ask you, what if people are like, okay, well, that sounds great, but I need cholesterol testing, and how do I do that?
I'm so glad you're allowing me to cover that. My clinic, which is that membership-driven clinic, has a special relationship with laboratories, MRI, CT scans. We kind of give that concierge experience of giving you the discounted price and passing off that discount that is given to my clinic to our members. So essentially, what you would pay, if your insurance would charge you the full price of $33 for a blood count, you're the kind of patient who would benefit from the $3 charge that my clinic gets, where you pay my clinic and I just forward your fees to the lab. And that whole billing function that I take away from the lab is why they're able to give that deep discount. So most of these tests are actually 90% discounted to us with a cash price. CT scans, MRIs, you would probably pay an ER in the thousands to do it. We can also get it to you for $500. And I've recently helped a patient with that. So yes, more information on that when people are concerned about their healthcare costs. We want to make things transparent, just like how from the very beginning, you dictate how much time you want from the doctor.
Right. I think that's important. And I think that's a hard concept for people
yes, that's
to wrap their head around.
Yeah.
Your service, essentially, your monthly fee is probably equivalent to a nice dinner out, a nice Friday night out.
Yeah, or much less. much less.
I guess it depends on what your fun is, right?
Yeah, exactly. And the whole point of direct primary care, you could look up direct primary cares all over the country. It's called DPC Frontier. Like if you wanted to verify what other doctors are doing, I'm not alone, but there are a few of us, throughout the country. And this is a growing model. We're about 1,000 doctors the last time we met in a conference all over the US. So it's called direct primary care. And if you were curious to see, there are other doctors who do this. It's DPC New England. And I also want to put this in, Karen, that I really go to where people are at. As you can see, the whole approach is building a relationship. Like, not tying them down to payments that, if they want to leave later on, they want to leave. It's a relationship. You're trying out establishing a relationship with a doctor. And when I say relationship, it's not going to be like that 8-minute experience. So I go to where people are at, wherever they're at in terms of their mindset, where they're at in giving attention to their health goals. That's where I go.
Right. So also clearly probably now you're doing a lot of Zoom meetings for your appointments, but if people wanted to physically find you, where would they find you?
Well, right now I'm using a Needham office and a Marshfield office. That may change. As you know, things are changing from week to week, the way that we're dealing with this pandemic. So those are my 2 locations right now.
Okay, wonderful. Thank you so much. Again, one last time, can you tell people how they can find you if they wanted some information?
Thank you so much. So if you Google me, and all my reviews are up there as well from patient testimonials, you can Google Genera Health Direct, Dr. Margarita Castro-Zarraga. If you just type Genera Health, it will come up. Genera. The website is Genera MD, GENERAMD, and our phone number is 508-591-0655. Call or text anytime. Thank you.
Wonderful. And is this just for members? You have some free like Facebook groups and.
Oh yeah, thank you for mentioning that, Karen. Yes, we have a light load health and wellness release community. You can find that on Facebook by typing light load, LITE load, LOAD, like lighten your load, but LITE LOAD, light load. And I also have a Facebook group for Genera, so they can find me there. Yes.
Thank you so much. It was great to see you.
Thank you so much for giving me so much time.
No problem. Take care. Hopefully we see you again soon.
More power to you, Karen.
You too.
Thank you.
Bye-bye.
Bye.